First, in the spirit of intellectual honesty, before I detail my reasons for distrusting the mental health care system, I feel it is crucial that I acknowledge the ways that it has genuinely helped me. This may seem like praise, but it's more of an open statement intended to provide a complete picture, an act of integrity that is essential to my argument as a whole. To its credit, the system introduced me to powerful and effective treatment frameworks. Cognitive processing therapy helped build an internalized structure for challenging unhelpful beliefs. The integration of existential therapy and fallacy theory, found in CBT, Read and Act, was highly beneficial because I am so familiar with these concepts, I can take personal responsibility for my own healing by applying them internally to resolve my conflicts. Furthermore, prior to 2020, providers demonstrated true compassion. They were incredibly helpful. At that time, I felt they acted with integrity, as I never got the feeling they were trying to manipulate my mental space to accept drug-assisted recovery from alcohol dependency. I was empowered to make my own choice, and I chose to receive medications without external pressure. While I suffered from unpleasant side effects, I believe that they were crucial for my continued sobriety. I may no longer feel that way about psychotropics, but the compassion and non-coercive nature of the initial gesture was not unappreciated. That's why, with a heavy heart and a commitment to intellectual honesty, I must confess that these drugs didn't actually serve the role I thought they did. Trazodone, while effective for some, has severe long-term consequences, especially when stacked with other serotonin-inducing drugs. After a while, these benefits diminished to sleep-inducing effects inverted, keeping me awake. This was compounded by a spike in blood pressure and mood instability. While raising the dose is common, it is an uninformed practice that can lead to serotonin syndrome. However, the most salient impact was not to my creativity, but to my cognitive ability, the very tool I needed to take personal responsibility for applying the therapeutic frameworks that I was taught. This brings me to SSRIs as a drug class. The entire argument for their efficacy is based on monoamine theory, which claims that depression is caused by serotonin deficiencies. This theory has long been disproven, and yet it is still passed around clinics as fact. This profound lack of intellectual honesty fundamentally undermines my trust in the system's integrity and its ability to communicate the true function of its drugs. What's more, the system's lack of integrity is clear when you consider that most serotonin receptors are in the digestive system, not the brain. In fact, 95% of them are in your digestive system. It's no wonder that these drugs cause digestive issues. For the longest time, I took personal responsibility for these problems, assuming they were caused by my past alcohol use. However, after discontinuing the psychotropics, I was magically able to eat spicy food again, my digestion normalized, and my energy and appetite returned, proving my initial self-blame was misplaced. Another phenomenon I noticed was brain zaps, a symptom of withdrawal. While I was taking personal responsibility while remaining consistent with my prescribed dosage, the symptoms somehow worsened after the immediate administration of the drug, well within its effective range. This represents a concerning phenomenon that, from an intellectually honest standpoint, cannot be reconciled with the way the drugs are claimed to work. Towards the end of the drug's effective range, I suffered from emotional instability and was racked by anxiety, and cravings became almost unbearable, which led to inevitable relapse. While I take full responsibility for my relapse, because that's on me, the volatility caused by these medications certainly didn't help. Because of all of this, I feel cheated. I perceive a deep lack of integrity and intellectual honesty from the prescribers of these drugs. I wasn't given an accurate representation of what they do or how they are expected to work, which led to worsening long-term outcomes until I took personal responsibility and stopped using them as a crutch. This breach of integrity was even more blatant with drugs like Vivitrol. It was advertised as lasting a month, but its longest effective period was 3 weeks maximum. Despite my prescribing clinician promising, an act that should be sealed by professional integrity, to prescribe emergency doses of naltrexone in the event of therapeutic failure, they did not. This further destroyed my trust in the system. While the prevailing argument is they were the wrong drugs, take these pills instead, this argument lacks intellectual honesty and is based on a fallacy. I haven't tried every flavor of beer. Does that mean I need to know how harmful it is for my health and for my mental well-being? I know this parallel may offend some, but the same phenomenon of diminishing returns occurs in both clinical and street drugs. Switching formulations can provide a temporary boost in effectiveness, but this adaptation period quickly shortens, and the therapeutic extinction becomes obvious. This pattern I personally observed. Sadly, the clinical failure to recognize this, a clear lack of intellectual honesty, undermines their credibility. I no longer see competent analysis, only ham-fisted attempts to force therapeutic effect where there is none. Given the long list of side effects, I am taking personal responsibility for my own well-being. My cost-benefit analysis of these drugs falls below the threshold of my further consideration. This is far from the only issue I have with the system. As much as I talk about the damage these drugs have done, I can acknowledge that the intention behind them was noble, to provide compassion and mental stability to society's most needy. Sadly, it's become more of a dirty band-aid fix to what can only be described as a gaping, festering wound. It can hold it closed for a while, but it also introduces new pathogens that make the wound worse. On top of that, it doesn't exactly stay on for long. This failure of the system's integrity extends to my recent encounters with psychotherapists, the people handling the other side of this equation. I've noticed nothing short of dishonesty in the face of accurate confrontation and a poor, fragmented delivery of therapeutic frameworks. In one group therapy session, a member was clearly ill. I took personal responsibility for my own health and sobriety by stating my desire to not get sick and ask to leave, as I had previously explained that illness directly impacts my job and cravings. The clinician's response was not one of compassion or understanding. She blew the situation out of proportion, blaming me for wanting to protect my physical health and stating he needs this therapy too. To have my valid concerns scoffed at by a healthcare professional was a disgusting betrayal of the integrity of her field. And I gotta say, it undermines the whole therapeutic process. It gets worse though. I witnessed clinicians deliberately misrepresent smart recovery by attributing traits to 12 steps to it. This is, at best, a failure of basic intellectual honesty, at worst, a deliberate act of professional malfeasance, undermining effective peer support groups to prop up legacy programs. The true failure of integrity, however, came when I called her out on her misrepresentation. Instead of practicing intellectual honesty by admitting her mistake and correcting herself, she chose to gaslight the entire room. She turned my peers against me and elevated herself as the expert, embodying the very antisocial and abusive behaviors that therapists are supposed to help us overcome, not model. The final example of poor mental health care comes from my most recent experience. This was not only unprofessional, but it demonstrated a profound lack of professional integrity and had a clear, measurable negative impact on my mental health. My personal responsibility for my own well-being faltered. My drug use went out of control. My spending habits became less disciplined, and I became more irritable and less trusting. And worst of all, it entirely destroyed my faith in psychotherapy in America. I started viewing all therapists as direct threats to my well-being. In places where I had previously tried to show compassion for the system's flaws, I no longer could. I hated them all because I saw what they had become. This is the best I can remember of his hateful practices, which lacked all integrity. He always spoke to me in a condescending tone. At first, I tried to offer compassion, giving him the benefit of the doubt that this was just a therapist's tone to make me feel more comfortable. Unfortunately, I never felt comfortable. This is where his lack of intellectual honesty became clear. He tried to pass off the idea that most people aren't manipulative, which didn't sit well with me. My own intellectual honesty compels me to admit that, frankly, I know most people are. I just don't think it's always intentional or malicious. His manipulation, however, felt deliberate and void of any integrity. I acted with integrity and shared crucial details about my childhood in a highly traumatizing relationship, in an earnest attempt to take personal responsibility for my healing. Sadly, he demonstrated a complete lack of integrity and compassion. It felt like he had used that opportunity to collect data he would later weaponize to emotionally wreck my cognitive abilities and force a diagnosis. His approach lacked all intellectual honesty. He tried to minimize my childhood events and get me to question my own memories to the point where I could no longer trust my interpretation of them. He would make comments like, "It's your mother is the problem." What he didn't understand that is I had already taken the personal responsibility for that relationship and had worked with my mother to resolve those issues. His attempt to blame her for the actions of other caretakers was a disgusting attempt to destabilize a hard-won family dynamic, one built with my mother based on mutual understanding and compassion, and it was damned near successful. Finally, all the information I gave him was such integrity he dismissed summarily in a singular event that has left me paranoid, unsafe, yet highly driven to take personal responsibility for improving my own understanding of the psychotherapeutic process. As I stated before, he weaponized my past, gish-galloped with Socratic questions designed to invoke a traumatic response, and overload my rational thinking. This was not an act of intellectual honesty. It was an attempt to force me to question my life and my judgment in favor of his benevolent care. He also used this time to force a legacy autism diagnosis upon me after communicating with the same school district that diagnosed it in the years following horrific abuse. That was really something awful. Given the known diagnostic overlap between PTSD and autism, a fact that seems to be acknowledged with intellectual honesty only in observations outside of the United States, this is highly inappropriate. This was a disgusting act of malpractice, a hateful turn of events, and a complete failure of professional integrity. For nearly a week, I felt like a hollowed out husk, violated. The same feelings I had associated with incidents of SA in my past. He not only forced his ill-conceived, intellectually dishonest diagnosis on me, he forced his way into my mind and behaved like a bull in a china shop, destroying whatever he wanted to build a false narrative. Unfortunately for him, my own sense of personal responsibility for my safety knew something was off. I had never come out of therapy feeling that way before. That violated. After a few weeks, the hollow feeling dissipated, and I took personal responsibility and fired him on the spot. His attempt to reschedule via text after that was further a sign of his profound lack of professional integrity. Not that he ever had any to begin with. He always had a tendency to forget to put up our follow-up appointments on his schedule. And I had shown him compassion and patience up until that point. When I took personal responsibility and attempted to report this to a licensing governing board for disciplinary action, their lack of integrity was immediately apparent. They took their time investigating. While the preliminary report I sent was AI edited, their response was automatically generated by AI. I never got the impression I was speaking to a real person. Rather, I was being dismissed and fed a bunch of AI slop. A cowardly avoidance of intellectual honesty to pacify me into thinking they were actually investigating. I know now that my act of personal responsibility in reporting this was met with a complete lack of systemic integrity. They were not investigating and never intended to. The message I received from the courts is that if you have a mental illness in the state of Indiana, you don't deserve justice. That is, unless they're going to throw you in prison on drummed up charges or bankrupt you with a one-sided legal proceedings. The system seems to lack all compassion, treating us not as citizens but as wards. Second-class citizens with no rights to anything but ridicule, invalidation, and spite. Some will say I am being unfair, but in the spirit of intellectual honesty, where is the unfairness? It seems to be coming from the lopsided way the Hoosier state chooses to enforce its laws and codes of ethics. In fact, it makes me doubt that there is a genuine code of ethics at all, one built on integrity. It seemed to be a facade, a mere semblance of justice. but it's a twisted justice, one based on a hateful legacy sorting the desirable from the unfit, which never truly died. However, just because I can't get justice from the system doesn't mean I can't take the personal responsibility for finding justice for myself. The impact of these beliefs and memories has been destructive, and they must be allowed to pass. Now that I am more competent in my practices and sober, I have a much better understanding of my internal landscape and can address this constructively. All damage from that incident has to be undone, and I'm going to begin that healing process. It's been going on for nearly a year. This is because, despite what I was told, I know better from a more enlightened perspective. From their understanding of trauma and autism comes from memorized information. My personal responsibility drove me to cultivate a deeper understanding of the underlying neuroscience, genetics, and philosophies informing these beliefs. In the spirit of intellectual honesty, I can no longer recognize their definitions. The clinical definition of trauma only has instrumental value. It exists only to qualify you for care. It isn't backed by science and has no intrinsic value as a descriptor. Because of this, I can dismiss it and use my own more accurate definition, which has served me very well in healing. As for autism, the common argument is that it is a complex disorder. Yet for people who seem so certain about that, they demonstrate a stunning lack of intellectual honesty about what it actually is. What's worse is that ASD came from merging three separate disorders. One of them, which was Asperger's syndrome, was formulated in a highly repressive environment informed by dark philosophies about human purity. The other, PDD-NOS, was a blanket term with purely instrumental value for parents, not their kids. And it will give them access to things like special school resources and maybe even state resources. Not only is the common understanding of ASD incorrect, I believe it is dangerously so. It's too generalized based on behavioral tests and unreplicated brain scans from heavily drugged patients. With so much overlap with other disorders, especially trauma, it looks like a valid disorder and a convenient label. Then they reuse terminology from legacy programs that were definitively harmful, like the level system. This was a slap in my face. Those programs were a sole cause of my dysfunction in my life. They isolated me, relied on heavy-handed punishment, and showed no integrity in the face of obvious abuse. They existed to discredit and destroy those put in them. This is not true ABA. It is an abusive misuse of it. So levels? Really? If I didn't trust the system before, this definitely sealed the deal for me. Then with all this baby talk, fake diagnostic criterion, dismissiveness in law enforcement, and identity politics surrounding what should be a useful diagnosis, it's not hard to see why my trust in the system is non-existent. And why, in an act of personal responsibility for my own safety, I can no longer feel safe around mental health care professionals. To me, they seem less like healers and more like social engineers whose purpose is to discredit dissidents. A secret arm of law enforcement that doesn't enforce public law but behavioral ones. They police thoughts and ideas and destroy people who threaten their role. They elevate those who behave in ways that society likes, regardless of how harmful those behaviors might be. They protect antisocial ideas while screaming about the horrors of narcissistic personality disorder. Now they're trying to do it with autism. What's worse is this is all happening with the rise of authoritarianism in America. Anyone who has a grasp of intellectual honesty regarding history knows that mental health abuse is a pillar of authoritarian control. Anyone who knows history certainly knows hateful ideologies were based solely on pseudoscience. Yet, they were used to destroy entire families and justify genocides. It's important to note that many of those shallow philosophies stop at genetics and inheritance. They do so on purpose. to simplify complex neurobiology into neat categories they can discriminate against. These ideas are not just incorrect, they shut down productive, compassionate discussion in favor of just destroy them, they're horrible, pathetic subhumans undeserving of compassion. It's an obvious form of misdirected racism. In conclusion, prior to this year, I tried to entertain the ideas of the mental health care industry with compassion. They seem to mean well, and I still believe there are clinicians who have their hearts in the right place, who value integrity. Unfortunately, based on my interactions, my deeper understanding of science, and my observations of our degrading social environment, there's nothing left to trust. Even the well-meaning, if educated with these shallow and destructive definitions, can turn into monsters. The worst part, they may never take personal responsibility or even be aware of the damage they've done. What needs to happen now is a move away from absolution and an honest, deliberate change within the system, an embrace of true intellectual honesty and integrity. As of right now, it seems capable only of harming for the sake of control based on pseudoscientific ideas born of old, hateful ideologies. When I see the number of people being diagnosed with autism drop, I'll know change has happened. But also when I see a refinement in the DSM, either that or its total abolition alongside the APA, its publisher and the arbiter of the field's seemingly non-existent ethical code. Until then, respect my personal responsibility and my decision never to interact with any of you. I not only think you can't help, I know you can't help. Now, not when you're acting like this. Mental health is not a dating service. It is a pursuit of the truth surrounding our very behavior. It demands intellectual honesty and integrity, and it should not be handled this haphazardly. For 30 years, all I've wanted was to heal. When I look back at my experiences, I can't help but feel deeply disappointed by those who are supposed to help. But unlike before, I am now taking full personal responsibility for my healing. I understand the mechanisms, and I know that with proper application of effective frameworks, I will succeed in reclaiming my stability and sanity. The crux of my problem has always revolved around people behaving abusively and surreptitiously while masking themselves behind good intentions. To those who think they can help without my consent, you cannot, because you are the cause. This is why I will not tolerate coercion. Your profession does not have a strong enough foundation or enough academic trust to justify such an act. In fact, coercion only demonstrates how far you've deviated from your core purpose as healers. Your explanations for disorders are shallow. You invalidate based on pseudoscience, and you prescribe drugs based on shaky pharmacokinetics. As you are now, you can only do harm. But for those of you I know are to those of you who I know are capable of asserting your own integrity in the face of these ethical breaches, I am speaking to you. I know the value of what you do, and I want your hard work to be recognized, not dragged down by this broken system. If you would like to help, you can do so by sharing your knowledge. I invite you to leave the names of treatment frameworks you think may be helpful. While I don't respect most of the system's current training, I will respect your intellectual honesty and your compassionate intentions. Ultimately, helping me means respecting my space, my knowledge, my experiences, and my rights. The ball is in your court. Do not disappoint me.